Hello, hello, hello. I think we are live there. A big welcome to everybody joining us. I hope you can see my slides there okay. We're just going to wait a few minutes to begin and get everybody logged in. I can see there are people joining us there. So yes, a big welcome to everybody today. I think these webinars are a great new initiative that we're doing here at TolaData. So we're running a stream of webinars related to different sectors. So this one, we're looking at digitizing your health and well-being projects. I know prior to starting this job, I think I kind of have a background in more like volunteering for NGOs and the customer service side of things. So I'm a customer success executive here with TolaData. So I have more background in that, but I think before starting, I was also always curious as to what the inside of TolaData looked like. So you may have been the same as me. So I think these are a great way of really seeing into the platform. And so I hope you get to really see into it today. We're just going to wait a few minutes there for people to join. You may be joining us through LinkedIn event or StreamYard or the YouTube channel. If you're in the YouTube, you will be able to add some comments. So our lovely colleague, Hannah Maroney, is in the comment section here. And she is a sales and account manager with TolaData. And so she'll be in the comments answering any questions you have. She is chatty even on a bad day. So she would love to see your comments. You can introduce yourself. And even if you're watching back on YouTube, feel free to say what your position is in the company, what you'd like to get out of today's session, or anything you'd like to add in the comments there. We want this to be sort of interactive, and join in with anything you would like to comment. So as I said, today we'll be discussing immunisation. We're looking at health projects. So Sive, our lovely colleague here, has created a project which is an immunisation rollout. So within the health sector, there's many different areas, but we will be just looking at this project. But you could also apply it to any area of the health sector. So Sive has done out a demo, like a real life project, and we will look at that today. I know there's people joining us here from like project management backgrounds. There's also like M&E specialists, but there's also health specialists. So I think it's important to keep in mind that people are coming to M&E from different backgrounds. So yeah, you're all very welcome today, and I hope you get something out of today's session. I think I might just wait another few seconds there for people to join. And then we'll get going. The layout of today's session as well, just to let you know. So we'll be doing a short presentation about M&E, the benefits of it, digitizing your M&E system. And then after that, Sive will be doing the demo. And then finally, we'll do a bit of a questions and answers round. So if you have any questions, you can wait until the end. We'll be using Merrymeter. Some of you may be familiar with that, but also pop them into the comments throughout as well. I might begin there. I can see a few more people have joined us. So to begin again, everybody is very, very welcome. My name is Anya. This is my colleague Sive, two very strong Irish names. So as I said, my name is Anya. I've kind of a background in volunteering for NGOs and then the customer service side of things. So that's how I came to TolaData. I'm from Ireland, but I'm living in Berlin, Germany, and that's where our company is based. And we also have some employees and offices in Nairobi, but we're a small team and we're very hands-on. So when you contact customer support, that'll be myself or Sive or possibly Hannah, who's in the comments. That'll be us dealing with you. So small team, if you have any issues, please get in contact with us, or if you have any kind of comments on the platform as well. We're always changing, we're always upgrading, so do get in touch with us and let us know. I'll now pass over to my colleague Sive to introduce herself.
Perfect. Thanks, Anya. So, hi, everybody. My name is Saiv. I, too, as well, am a customer success executive here at TolaData. I'm originally from Ireland, like Anya, but now I've moved over to Berlin, which is the headquarters of our organization. So, today I'll be showing you a use case that we've put together for the health sector. I'm really looking forward to showing you that. As Anya said, it's going to be applicable to a lot of different projects that you might be working on. And also, especially, I want to be able to show you the powerful tools that we have that are going to allow you to expedite and automate a lot of the menial tasks that you're doing. So this allows you to focus really on the work that's important. So with that, I'm going to hand you back over to Anya.
Love it. Very, very exciting side. So I'll quickly now run through what we'll actually be covering today. So why is monitoring and evaluation important from the sector? So I know many of you joining us have organisation running health projects, and M&E in this field is so important because it can truly have such an impact on your results and your global impact on communities. Next, we'll then be looking at how digital tools can help like the automation of the process. And then we'll be looking at how to choose your digital tools, because there is lots of programs now out there. I know in the past people used to build their own tools, but now there is so much on offer that you can go out there and buy one off the shelf. And then we'll be looking at the demo. So Sai will be showing us how to bring all that data together, managing that data in the indicator section and the activity section, which is more like the project and program management side of things. And then she'll be looking at making the most out of your data. So for the calculations and analysis, and then we'll be telling the world what you achieved. So we'll be looking at the dashboard section, which in my mind is my favorite part of the system. It's very visual and it automatically updates all your results into your created dashboards. So you'll be able to see all your results. And then finally, as I said, we'll be finishing with questions and discussions. So why use digital tools for M&E? So monitoring and evaluation was traditionally paper-based, which meant a lot of administration, very time-consuming and very resource-intensive. So you might even end up like this poor guy here in the cartoon. He's going in to sort out his data and he may never return. So we used to physically store this data, but now with these programs, we can automate the process. And there are many advantages to moving towards these digital tools for monitoring and evaluation. And hopefully you won't end up like this poor guy. If I click here. So why use digital tools for M&E? So for example, you can first use them to improve your data quality. So whenever data has to be entered manually, the risk of errors increase. It's just human nature, but digital tools can help reduce this risk and automate that process. And then on that point, the automation of your data processing. So for calculation of results, aggregation, analysis, visualization, and even reporting. So for example, if you're calculating the number of vaccines administered across different sites, this automation allows the collected data from all these different sites then to be fed up into an aggregated indicator. So somebody over the project can have a quick overall glance at how the project is getting on across these multiple different sites. And that kind of brings us into the next point then, the real-time insights. So this means that information will always immediately be available once you put it into the system, and you can be sure that it's up to date and accurate. So without a digital tool, I don't think that you can be certain that it's up to date, because it might be on a piece of paper, human error, it doesn't always work out that way. The next point there, to connect easily with remote locations. So these would be inaccessible locations that may be difficult to monitor. So if your org is administering vaccines in remote locations, by accessing the internet and inputting this data, this can feed into the parent organization, and then even with offline data collection. So there is tools that you can collect data offline. TolaData is an online platform, but you can integrate other machine readable sources into it. We will touch on that more later on. And then finally, it helps to implement best practices. So if you have a digital tool that your whole organization is using, there's a system in place. Digital tools now are very intuitive, so you don't have to have big experience in M&E, you don't need to have a degree, you just need to have your log framework done out and then use the platform to input data. It really is quite simple. And then finally there, the knowledge management and data retention. So with digital tools, you can ensure that data is stored in one place and easily accessible to staff during and after the project. So you can keep it, for example, on TolaData, and once you have a license, you can keep all your data retained on the platform. It's accessible from anywhere, and it's online, and it's protected. And then there's also like a super user, so you can also stratify different levels of permission, so not all users can see all projects. And this is great for sharing information between different projects and having users only to be able to view what they need to. These are only 6 examples here of why we use digital tools for M&E. If you have any more, please pop them into the comments section. And I see Hannah, I've just clicked in, I can see Hannah is in there already. Please feel free to interact. Next up, so what tools are out there? As I'm sure you all know, there are many data collection tools, so we've broken them down into these 3 categories. Firstly there, you can see the data collection, so there is Kobo Toolbox, as I mentioned, so that is the offline machine readable source that you can collect data out on the field without an internet connection. And then when you come back to TolaData, there will be a token that is integrated with the system, and that information will automatically upload. Other data collection sources is the TolaData form builder. This is integrated into the site, and you can just enter, once you send out your forms and people input the data, it's automatically uploaded into our system. And then you can see the other ones there, like survey, CTO, ODK, many different examples there. Next then, it is the management and reporting tool. So that's like TolaData, that's where we come in, Legalto, activity info. And there is a final step for more in-depth look at your reporting, so that's advanced BI analysis. So like Power BI, Tableau, as I said, that's more for an in-depth look at your data. But then how do you choose? Because there is such a selection out there, how do you begin to choose? So there's a number of factors to consider when choosing the right tools for you. Number 1 is the tool must be appropriate to your context and requirement. So there are many questions to think about: what type of project it is, how complex it is, how much data will be gathered, and then also the technical skill of the staff involved. So say if you're collecting data on immunization or managing vaccine rollouts across multiple sites, your software will have to have this capability to work across multiple sites and then also be user-friendly. So your colleagues or the people you work with will want to use it, and it's not a daunting task to then go and input the data. You then need to consider the possibility of integration with other tools, our second point here. So as mentioned, this is like with KoBoToolbox, the offline machine readable source. Then that leads into the next point. How will the tool be used? Is it going to be offline or online? So particularly for data collection, if you're working in emergency health relief, offline capabilities could be needed. If you're just working in the office, online capabilities are fine. Next, we have data protection here, which is a big buzz at the moment, or at least was. I think we've all gotten used to it at this stage, but it's important to check where your data is stored, the compliance with local regulations. So for example, in Europe, this is the GDPR. Next there, you have to, as I mentioned, make sure it's user-friendly for your users. So people could be coming to M&E from many different areas. You have to make sure that the software is easy to use, so you're not adding more things to their to-do list. Finally then, the cost to set up. So the cost of implementation, there's many tools already out there, so I don't think that there's any need to pay for customizable tools. You just have to know what your organization needs and then go out, find your tool and find the best price as well. Next here, we are looking at an integrated data cycle with TolaData. So you can see here, this is an example of what the full data cycle might look like. First, you use digital tools for your data collection, and then with TolaData at the heart of the monitoring and evaluation for the management and tracking, and then finally visualization and reporting, and then you have the optional EI analysis. So you can see for the data collection, there is the different ways you can collect data, and then that brings into TolaData finally then for the reporting and the visualizations, because without that, yes, it's great to see the process and to see how your projects are doing, and it really does help you use your resources better. But without the reporting and showing to your donors how you're getting on, I think that's a really important process. We can all agree. Finally then, I think it's time to see TolaData in action. So I will now pass you over to Sive, who will show you the platform.
Perfect. Thank you, Anya. So I'm going to just start off by sharing the screen. I'll just ask you in one moment just to confirm that everything is working as it should. So do you see that okay, Anya? Will I increase the font? Excellent. Perfect. Nice. Sweet. Thanks so much, Anya. So now everyone can see the TolaData home screen. So in this portion of the webinar, I'm going to be bringing you around the TolaData platform. I'll be showing you all the cool different tools that we have. And also I'm going to be consolidating a lot of the info that Anya just gave you on the importance and really of just the power of being able to digitize all of your M&E processes. So in this demo, I'm going to be showing you a nice use case that we've put together that has been aimed for health and well-being sector projects. This one, as Anya had said, is about immunization, and it's going to be in particular just focusing on a small village, a remote village, and how we've overcome those challenges. So just to give you kind of a brief orientation around the website, here you see the homepage, and on the left-hand side, what we have is our navigation panel. This navigation panel will bring you to all the different sections of your project and/or program. In the center here, you have an overview of all of the different projects you have. With TolaData, you can make as many projects as you'd like. And now just to find my projects, since we have so many, I can use our handy filtration filter that you'll find here. With this filter, you can filter by country, by status, and also by custom group. And that's the one I'm going to be using right now. With this, I can put together, customizable list of either, projects grouped by theme, by level as we have here, or even by portfolio, an individual that you have yourself. I'll select the one that I need and I can filter that. By doing this, I now have just like the short list of all the important projects that I have assigned to this group. And then I can go immediately to the project that we're going to be looking at today. So for this project, I'm going to be showing you a few different levels. I'm just going to be showing you the sections that we're going to be focusing on today so that you have an idea beforehand before we really get into it. So to start off with, I'm going to be showing you around our details section. This is going to be how you're going to configure the overarching details of your project, as well as important features such as the disaggregations and also the targets of your project. Within this activity section, where you can see it here, this is where you're going to be putting together your strategy and also the actionable steps that you'll need to go towards your goal. I'll be showing you some other cool features such as, an approval workflow and also budget creation. Under the indicator section, this is going to be the really cool and interesting part. This is where I'm going to be showing you how to set up your results framework, as well as your all-important KPIs, your indicators, and how you can start monitoring, your trends and the patterns as you're, going to be inputting this data. And finally, I'm going to be showing you the dashboard. These are the windows into your project, how well it's going, how successful it is, how you can put it together very beautifully with nice graphics and colors, and also how you're going to be able to share it both internally and externally with your partners. So with that summary, I'm now going to bring us back to the home page here. And once I've selected my project, I can go immediately to the details section. So as I had said before, this detail section is where we're going to be configuring the overarching information of our project. And so here, as you can see, I can, configure the name, set the status of my project, include the important start and end dates, input a project code, link some associated countries, also maybe put down the funder of this project. And as I mentioned before, you can link these projects in portfolios, by theme, etc. And this is where I would be doing that. On the bottom here, we can include some extra descriptive information, including links and images. I've just noted down here that this is a project that's going to be part of my SDG 3 project. So these are going to be projects that I'm leading to ensure that we're meeting our goals. So in this project as well, I'll be including an SDG indicator that was required by a donor, and I'll be showing you how I've been measuring that. Then here on the top right-hand side, we have our budget. So this budget provides great info on how much we have allocated to the project, how much we have spent, and how much we have remaining. This section will be reflected in the activity section, which we'll be seeing very soon. Under the Sites tab that we have here, this is where we're going to be putting down the points of engagement. So this map gives you a great overview look of where all your affected community is, where it may be the health offices or M&E office. You can create as many sites as you like, and you can include also contact information of the people located at these sites, as well as precise geographical coordinates if it's quite remote. And these are displayed on this lovely, nice Google Maps map. Under phases, this is where you can put together a timeline for your project. So this really helps you split up this project into meaningful chunks of time. So you can separate it by like a start, middle, and end, or by different processes that you have. We usually do them in what we call phases. And we can filter this chart by day, week, or month. Under the Stakeholders tab, this is where you can put together all of your stakeholders, your donors, your partners, whoever are really important actors in allowing your project to function and work. This is important really just to keep in mind always when you're working on a project, because with different donors, they will have different requirements and different expectations. It's very important that you always have these in mind as you're setting out in your project to ensure that you're fulfilling all of their criteria. Under the documents section here, this is where you're going to be linking all the important documents, all the important information that's related to the project. The beauty of this is you're really creating a hub for all the important knowledge, because too often, lots of important documents just get lost in email threads. They get lost in people's computers. And in effect, this causes a data silo. And what that means is that certain individuals of your organization are not privy to really important information, up-to-date information that they need. And this really hinders your progress. This doesn't allow you to harmonize with your team and to really be on the same page with everyone. So that's why it's really important to have one spot to have all the important info that you can link either via URL or via your Google Drive. You additionally also have the option to input a location if you actually have physical documents. So let's say, for example, in this project, I have some vaccine information booklets. I can note down where I've actually put these. So I can see that that's in the M&E office, in our main hall, in the cabinet 4A. So this is just very handy for anyone that just needs to know the physical location. So under our reporting period, so as we know, targets are very important. It's very good to just be able to prioritize specific goals for you to aim towards. And on the system already, we allow you to set your own annual targets, semi-annual, quarterly, monthly, etc. Pardon me. But often with stakeholders and donors, they do have, reporting periods that might not conform to the average calendar year. So that's why we have provided a tool here to allow you to set your own customizable period. So that could be 2.5 months, 4.5 months, really any time that you need. And, then the system can automatically calculate these periods against your actuals, so you can have a nice overview of how they compare. Now for disaggregation types. So as we know, when we're inputting data, and collecting data and monitoring it, it is really essential that we understand the different layers and the different aspects to this data. This, say for example, you're measuring the number of beneficiaries for a program you have. It's great to know how many people are benefiting from a project, but it's extra important to know who is benefiting. Is this affecting a certain gender, maybe a bit more than the other? Is this affecting a certain age more than the other, a certain class? It's really important to keep these in mind to ensure that certain policies, certain approaches that you have are not inadvertently benefiting one section of society rather than the other. And that's the reason why it's super important to have these disaggregations in place for you to be able to monitor that. On the system here, we already have a disaggregation that allows you to break down the data by country by the ISO standard. But with every other disaggregation that you have, you can create your own customizable one. We have plenty here with age groups, the community that the person is involved with, the region that they're from, their gender, of course. And these disaggregations can be set on one project or it can be set to all of your projects. And the beauty of that is when you're in a position of being able to aggregate a lot of this information, you're actually able to disaggregate this whole entire number. What this enables you to do is to see your overall impact. And that's why it's very powerful to know the overall breakdown of all the information that you have. Now we're on the team tab. So just as an intro to this tab, on TolaData, we take data security very seriously. So this is why inbuilt in the system, we have a lot of measures and a lot of guards to ensure that your data is going to be very secure. So when you create a project, for example, this project is going to be independent. It's going to be sort of self-contained, which means that, even if you are a user on the platform, you don't automatically have access to this project. Therefore, this is why we've created a team tab. So this allows you to invite users who are on the platform to be linked to a certain project. So for this specific project, I have linked all of these different individuals with this drop-down menu. And as a further precaution, what we have here is we have a system of roles. So we can actually assign different levels of access to the data to these individuals. So what we have here is, a tiered access. So we have view only, and that represents sort of the most limited access to this data. And as you can imagine, this just means that the user can only view the information, but they can't engage with it. So they can't delete it inadvertently. They can't modify it, to skew the results. They can only view it. So as we go up these tiered levels of access, we can give the user a bit more flexibility, a bit more power, just to project admin, which is the full level of access. So they can modify, delete, change, different tools and features for the whole project. And this again just ensures that you know who can do what, and you can minimize the effects or the damage to your data. Finally, with this sharing tab, so in line with our policy of data protection and having all projects as self-contained, we've actually created this share tab, which will enable you, at some point, if you need to, share some information from one project to another, that you can. So what this tool in effect does is that it creates a channel between one project and another, and it allows you to extract information. This again will be very useful for you if you're creating an aggregated project that will be able to count the beneficiaries of many different sub-projects. So here I've already created a channel with one of our other projects. So this project here can take the information from this one. And with that, we can see who shared this information with what project and also what time. There's also the option here of unlinking this channel. So once more, again, all these projects will be contained. We're now going to move on to the activity section. So this is going to be your project management, your people management, or essentially this is going to be the section that really lends itself to your strategy. And so as you can see here, we have this beautiful list full of nice colors and information. This is a nice, hierarchical tiered list. So we kind of have the most important activity on top here. And with some indent here, we've kind of got a task, and we can even include subtasks to further break down this activity. So this allows you to step-by-step break down, important maybe phases or just maybe a very laborious activity. And here you can see all the different processes. You can see the progress of each individual activity, who has been assigned, important start and end dates, a budget if that's included, and also some nice, visual information of how well an activity is going. And this is going to be super useful for your project managers who just need to take in a lot of information and then go on about their day. So to show you how to set up this activity or what this activity can be used for, I'm just going to be showing you an example here at the bottom. So in essence, this activity that I've set up, this is designed actually for a stakeholders event. And it's when I needed to put together a stakeholder event to be able to explain to stakeholders why we need to be funded for this vaccination program that we're going to be rolling out. So here I'm going to be showing you step by step how I did that. So once I've clicked into the stakeholder event here, I can modify any information that I see on the activity list. So again, this includes the name, who's responsible, the progress, the color, important dates. And also, if I want to also link this as part of my grand timeline, I can also link it to a phase that I've included. On the bottom here as well, of course, you can include extra descriptive information if you want, including links and pictures. One of the first tools we're going to see now is the approvals tab here. So in here, you can set up your approval workflow. This is super easy to use, and it's entirely configurable by your organization. So in the stakeholder event, I put together a budget, and this was going to be a bit of a costly budget. So what I had to do was I had to, of course, send this to someone responsible. So what I did was, with our customizable list, I selected budget approval. I assigned it to Anya. And I included extra bit of information, including, maybe a link to the document that I had for my budget, and also images that I think that you would have found useful, for the location that we're going to be taking, etc. And when I was happy, I clicked save. And so what will happen then is that Anya will receive an email that will redirect her here to review over the information that I've presented to her, and then she can make her decision on whether or not to approve it. This is really great because it's a nice, trustworthy, and reliable tool that you can have that will give you the date stamp of when it was submitted and when it had been approved, and also the decision itself. So when you're working as a team, it's really great just to have that visual confirmation and also this online visual indication that it has been approved by a manager or someone responsible. Now, our second tool here is our budget. So this is where we're going to be able to be putting all our budgetary items that are necessary for this specific activity. So here I have already included a fair few items for this stakeholder event. And so we'll take, the first one here we have, for example, I had set out to get, I allocated rather 5,000 to the decorations for this event. As it happened, I didn't spend all of this money. I got many different discounts. I was able to negotiate it down a little bit. So in fact, I only spent 3,000. What the system will do for me is it'll actually calculate what budget I have remaining. And in addition, with this remaining budget, it will put together the total of my remaining budget. So I have an idea down here of what that would look like. I can also create some nice graphics later on, which I'll show you, that you can do either by activity or by budget. Under the documents here, this works in the same way as it does on the details level. But what is really useful here is that you're actually going to be organizing your documents activity by activity. This is just very useful for a team, if you're collaborating with the team, to have access to the most relevant files to each individual activity, which is why we've included that here. And once more, you can link these either by URL or a Google Drive, or of course, include the physical location if that's relevant. Under this indicators tab, this is where you can link relevant indicators to your activity. What this really enables you to do is to be able to measure the success and the progress of this activity. So here, as we can see, I've linked two indicators which allow me to see how many stakeholders attended this event and also how many have pledged donations. Here we can see important bits of information, including the status and also some actuals regarding, the actuals versus targets. And finally, now we have our sites and stakeholders. Once more, this also works as the same way as it does in the details level. But again, even within projects, you have stakeholders that invest and have a stake in individual activities that you have. It is very useful to always be aware of the requirements and again, the expectations that they have for each individual activity, which is why you can also link it here. And just briefly to show you, when you've been feeding the system in with all these different activities, the system will automatically generate the start and end of each activity, task, and subtask. So this allows you just to have a quick overview of when these are due and when they are occurring. You even have these highlighted activities here, which are actually your milestones. This graph can also be, of course, filtered by day, week, and month. And now we're going to bring you to the indicator section. And this is, of course, one of the most important sections. It is really the heart of our software to be able to track and be able to see the amazing progress that you're doing on your projects. And here in this section, you have three main tabs. So that's the indicator list, the results framework, and the exports. We often will start with our results framework. So that's why I'll be starting here. Under this tab, you have a very dynamic tool, which is our results framework. This allows you to create, let's just say your direction for your project. This is going to be able to help you do your long-term goals right down to your more immediate ones, and it'll just lay out the plan that you have to achieve these goals. So what I've put together here is I've put my long-term goals here at the beginning, and I've added all of these elements below by just clicking these plus buttons. So we have on the top here our overarching SDG 3 goal, good health and well-being. So that's our goal for the long-term future. And then underneath, I have my more immediate goal for this project, and that is to improve the immunity of my target village. Then how I'm going to do this is I'm going to help improve their resistance against this virus. And the virus we're going to be actually dealing with today is COVID. So a very relevant topic for the times that we live in. And how I'm going to do that is I'm going to have a two-pronged approach. So I'm initially going to be setting up the infrastructure, the staff, the manpower, and also I'm going to be ensuring that we have a secure distribution chain so that we can have these vaccinations coming in at a good time. And also the second portion of our approach is going to be the awareness campaign that is going to be around these vaccines, because with any vaccine, there is going to be, some skepticism. There might be some worry. So that would be just to alleviate any fears that they have and to highlight the benefits of this vaccine. And then, of course, the administration of the vaccine itself. This tool here can, of course, be modified over the course of your project, as I know things can change. These elements here can be moved around. Different colors can be included, and you can, of course, modify anything that you've included before. What's great about this tool as well as it serves a secondary purpose, and I'll be showing you that right away. So when you go back to your indicator section, you'll see that the elements that you have just seen provide the nice title and headings for all of your indicators. And now this is really great because when you're putting together your indicators and you're really trying to be precise and customize them for your project, it is so useful to be able to hover over all of these individual elements and to just be redirected and to be sure that you're on the right path. So as you can see on this indicator list, we have it really nicely organized. Here we can just glean so much information in a very quick manner, so we can see what are the important indicators, what are our KPIs, what are the formats, how are we measuring it, how often are we collecting the information, what's the status, is it on track, are there any delays, has it been abandoned, and also some up-to-date information on the actuals versus targets, including some updated information here as well. So I'm going to just briefly show you how to set up an indicator. It's super quick. And there's also an option to do a bulk importation for even quicker import. So for an example here, for an indicator name, let's just say number of vaccines delivered. That's important to know. What I'll be able to do now is I can select the format. So we have 3 options. We can choose between numeric, percentage, or qualitative. In this case, I'll choose numeric as we're trying to figure out the number. Next, we're going to be selecting our desired direction of progress. I want this value to be increasing. I want the number of vaccine deliveries to continue to grow. So that's why I'll choose increasing. But if you're wondering why would you use decreasing, for example, in this project, I have an indicator measuring the rate of COVID cases. And in that instance, I would want that to be decreasing because I want less COVID cases to be present in the community, let's say. Under our target, this is going to be the life of project target, your overall target, because you can set intermediary ones if you'd like. So let's just say I want 50 vaccines delivered. You can include a baseline. This is perhaps the number of vaccine deliveries you had before the project started. It's available if you need it, but you don't need to fill out this cell if you don't want to. And then on the bottom here, you have a tick box, which allows you to create this into an aggregated indicator. I won't do it in this case, but I will be showing you what an aggregate indicator is and also how it can be used. So once I'm happy with that information, I can quickly drag and drop it to its appropriate heading. And now I'm going to be showing you inside one of our indicators here, just to show you how you can record the information of the indicator. So I've selected it into one of the indicators that we have here. And what you can do is you can modify, of course, all the information that you've just seen on that list. That gives, again, the project manager an overview of the progress of this indicator. But if you scroll down a bit further, you have these opportunities to include a description for this indicator. So this can be, why are you collecting this information and, the context surrounding it. Further down, you can also include in the notes section, perhaps maybe changes that have occurred over the course of collecting information for this indicator, maybe even the disadvantages of, collecting the information. Is it reliable? Are there ways in which you can improve, etc.? And at the bottom here, we have, places here for you to put down the source of the information, why you're using the information, and how often are you going to be reporting it. None of these cells are mandatory, but we'd highly recommend that you use them, especially if you work in a team. This just enables everyone to have the same knowledge and also to really promote the best practice of collecting information on this indicator. Under targets and disaggregations here is where you can modify the target, baselines, etc. But more importantly, for me anyway, it's where you can set your intermediate targets for this indicator. So this indicator is for measuring the rates of COVID cases that we have. So I want this figure to go down. And that's why for these targets here, you see that for each quarter, I want the overall amount to decrease. You can set these, of course, annually, semi-annually, and also according to, some custom reporting periods that you've set up for your donors. And down here, I've also linked a disaggregation. And with this blue link here, you can also connect a few more or link a few more disaggregations if you like as well. Under the collected data section, this is where we can add the data to our indicator. So we have two options to do so. We can do it manually, or we can pull from a data table. So we can enter our value. I'll just say 20 in this case. We can include, the date that the data was collected. You have other options to include identifiers. So this will help you distinguish this collected data from another, and also a site if you want. There is also the opportunity to include some evidence, some additional notes, and to disaggregate the data. So if I want to disaggregate via gender, let's just say it's a breakdown of 10-10, and we can save. And as you're filling out this information, this will update in the progress here, and you can also set a different status if you want. And since I'm measuring rate, this is why I have the calculation on last collected date. But of course, if I'm calculating something else, such as average income, I can select it to average or even median if I'd like. The second option for us is to pull from a data table. So once more, we can include a date, include other useful bits of info for this collected data. We can select our data table. We can use a data column here and select the data column that we need to extract the information from. And below, we have different calculations and formulas you can use to use the information that you have stored in the data table itself. Also, you have additional cool tools here, such as conditions. So this will help you, hone down on specific bits of information. You can disaggregate as well at the bottom here if you want. And as you've been, feeding the system very diligently, as I have been here, you can then get a nice overview of all the results that you've put in. So immediately you're met with these lovely bar charts that are calculated according to the periods that you've set for your donors. So you can see what that looks like. You can see how do your targets that you've set compare against the actuals. And then finally, you can get some disaggregated information here. And this reflects the calculation that you've set under the collected data there. Since I have it on the last collected date, we see what the breakdown is of the last collection that we had. So now I'm going to be giving you a quick overview of our aggregated indicators, and I'll be using the example of the vaccines that we administer. So here I've set up sort of a workflow for me to monitor how many people have been vaccinated against, COVID, with their first shot, their second shot, and their third shot. So I can see here how many have been vaccinated already with the first, how many have been with the second, and how many with the third. With the third is what we consider to be fully vaccinated. So before we even get there, we can see, how many are in the waiting list to get their second, how many are in the waiting list to get their third. And once we've collected the information from the third, we can actually aggregate this information to say how many people are fully vaccinated against COVID. And one step further, I can aggregate this information to my SDG goal. And the SDG indicator that I've had to fill out is the proportion of the target population covered by all vaccines included into their national program. And so here I can aggregate it once more. And let's say if I'm running other programs to do with vaccinations, let's say I'm also vaccinating against cholera, I can, create an overarching project that will allow me just to monitor how many have, beneficiaries of this vaccination drive that there are, and I can extract this information and get an overall view of that in an aggregated project. With these aggregated indicators as well, you also have the possibility of, having different formulas. So, it's not even just aggregation that you can do. You can actually perform different calculations on different indicators. So of course we have sum is what we're using usually, but you can of course do subtraction, multiplication, division, and average. And also you can just you can do weights and adjustments. This is great for mitigating the effects of double counting if certain people are attending multiple events. And you can also do currency conversion, for example. It's really flexible, and the sky's the limit to the imagination you can have with these different features that we have. And once you have filled out your indicator list and a lot of the data, and you are coming to the end of your project, you can, of course, export the information that you have for any post-analytical softwares that you might use, such as Power BI. So you can also have customized reports if you want to only have specific information. So that is why we have this tab as well here. And now I'm going to be bringing us to the dashboard section. And I'll be showing you a dashboard that I put together once I had come to the end of my project. And this is, again, the opportunity that you have to be able to demonstrate all the wonderful work that you've been doing. And, in the dashboard section, it is really rewarding to be able to put quickly together nice graphs, nice bar charts, nice pie charts of all the work you've put into your project. So on these dashboards, you will populate them with what we call widgets. They're these square boxes here. And you have a lot of different types that allow you to display images and texts. Like also I use, a lot of text here for, easing the viewer into the information or the results that I'm about to present, and also to give a bit of background. You've got some nice maps you can include here that again will give insight over the affected community and where the locations of the health center are. As you scroll down, you'll just see, the large variety of different displays we have here. We have the statuses of our indicators, we have the actuals versus our targets here, nice line graphs, and again we can create a lovely narrative just to be able to explain how did we go about achieving all of our goals, how well did it go, what didn't go well, how did we overcome that. And you can see there's non-cumulative graphs. We'll see down here that there's some nice also disaggregated graphs as well, and actuals against targets. So with these different boxes or widgets, you can change their size, you can move them around as you like, you can lock them so that they can't be moved. And also, if you're not particularly fond of the color that I've chosen here, fear not, because you can actually put together your own lovely colors that can be, catered for your organization or for even your own taste. And so as you can see here, at any moment, you can change these colors, and in a second, your dashboard will reflect the colors that you've just selected. So maybe you can see it better here. As Anya had previously alluded to before, these dashboards are fantastic as well because they upload in real time. So when you update, your indicators, or, if there's been any change, this will update and you'll see the most updated data, which just allows you to focus on what's important and not what's on this dashboard. So you can set it up and then just let it be, which is really nice not to have to spend hours doing. With these dashboards as well, they can be either printed and turned into a PDF, and they can also be shared both internally and externally. So you can do it internally with a user, a project, or you can use it externally by generating an unguessable link, copying it, and the user can send this to a stakeholder, a donor, and then here the donor will get the most up-to-date information. They can interact with their dashboard and see what's going on. And this creates a really nice dialogue between you and your stakeholders and donors to be able to communicate your latest findings. They can provide maybe advice, maybe they have different suggestions on, how you approach different tasks, etc. And this just allows you to really have a nice dynamic relationship. So I have given you a quick overview of all the amazing tools that we have, and we are constantly getting new ones all the time. So I hope with this demo, you can just see the power of digitizing your M&E processes, how this really makes your life a lot easier and allows you to focus on the work that counts. So with that, I'm going to hand you back over to Anya now, and we'll take your questions.
Thank you so much, Clive. That was brilliant. A really meaty project, I think. I think sometimes, I'll just share my screen there. I think sometimes when I hear the word COVID, I like shiver a bit, but it is a really great example of a project and how you can use all the features. I see in the comments there, Hussein mentioned that it was slightly hard to see. Really sorry about that. We will look into that later on and figure out. He suggested maybe using Zoom or another app. And I know StreamYard is the best for streaming live, but we'll definitely look into that. And I also seen from Hannah that people are asking about free trials. So we offer a 30-day free trial. If you go onto our website, TolaData.com, in the top right-hand corner, there is a green free, or a orange, in fact, free trial button. If you click that, you will enter your details, and then you will be sent an email to set up your password. This email could be directed to your spam, but you can get set up straight away on the platform. And then we'll be with you throughout the 30 days for support. And any questions that you have, you can contact us in a live chat function in the platform, or contact us, Anya at TolaData or Sive at TolaData.com. And we'll be there to help you with any questions with setting up your data, or any issues you have with getting into the platform, or anything at all. So our commitment to the sector, we're a tech for good company, so we're a social tech company. We offer 50% off for NGOs. So that means only for 2-year users, it starts at $49 a month. And you can also cancel at any time. So I think with a 30-day sign up and then being able to cancel anytime, it's a really great way to see the platform and really get used to it. I will mention as well, we have a community support program. So as TolaData is committed to the inclusive digital transformation, if you have a grassroots organization, there is some criteria that you can apply for. So say if you have funding less than, I think it is 200,000 USD, you can apply for this program, and then you will get 2 licenses for only €19 a month. I can see some questions coming in there. Can this tool be integrated with other sectors not health related? 100%. So the platform can be applied. I think from the demo you can see how indicators like setting up events or these things can be applied to any sector. It's really flexible in that way. It can be applied to budgets. So really is very flexible. I'll quickly go now to the question section. We just have a few minutes left. So with the Mentimeter, you may be familiar with it. If you go to menti.com, enter that code, or use your phone and scan that QR code, you'll be directed to a page which you can then enter your questions. I actually might leave that for another second if people want to pop their questions in, and then I'll flick over and we can start answering them, or you can pop them into the comments there either. I will mention as well, we will circulate, there is a free gift we have put together after this webinar, so we'll send it to you. It has some resources about like M&E facts. It has a look at the SDG 3, pardon me. So it has a look at that and like up-to-date reports on it. There's also, at the end of the document, one of the links is to an interactive map that if you click on it, it shows how the progress of the SDG in your country, which is it's like a bit daunting actually to see it all. It's like a red, green, orange system, and yes, it shows that we have a lot to do, but positive in some ways. I can see some questions coming in there. So if I sign up for free trial, do I enter payment information? That is a great question. You don't. So the 30-day free trial is just your email and your name. And then with that, you can set up your 30-day free trial. After that, if you want to go ahead with licenses, you can contact us and we will send you an invoice. So that is how it works. And there's no payment upfront, which is a good system. I'll see now if there's another question going in. I'll wait another minute. We are nearly at time. But yeah, I think that was a great project from Sive, so thank you very much. And again, any issues or if you have any other questions, you can contact us. Contact us after and we'll be more than happy to help you. Hi Cornelius, I just wanted to know about TolaData privacy. Will data be visible to other users? So no, it won't. There's different levels of permission that you can give to people in your organization. So if you are working with many organizations or even people within an organization, each project is individual. So you can share data between them if you want to, but there's like a super user who has rights over giving different people permission. The next question there, I can see any limitation on the number of users by an agency. So this completely depends on the amount of licenses you want to purchase. As I mentioned, for 2 licenses, it starts at €49 per month. You can pay annually or per month. It's no different to us. On your free trial, you can add as many people as you want to your organization. So you can have your whole M&E team or all your health specialists in the platform trying it out. And then when it goes to paying for licenses, that is when you can tick or decide who actually use the licenses. The final question there, I can see, can I add data from Kobo Toolbox? You can. So in our admin console on the platform, you can integrate a token from Kobo Toolbox. And when you put this in, you only enter it once and then it will automatically update the information once it's entered into Kobo Toolbox and you reach an online source. This will automatically update into our platform. And then that again feeds into the indicators, which feeds into the dashboards. So very automated process. Another question there. If I need to share reports to a donor, do they also require a license? PS, very useful webinar. Thank you. No problem. So with this, no. Users need a license if you're inputting data or in the actual software, but sharing outside your organization, you do not need a license. So that link that Sive entered at the very end of her demo, that could be viewable by anybody in this demo. It's kind of a great way for donors to see it, and you can even integrate that into a website. So say if you integrated that into a website or sent to donors, once they have that link, you can turn the permission for that link on and off, but that link is live once the permission is on. And again, that will be automatically updated. So if you share the link, it's still going to be updated with new information and new data that is in the system. Any more questions there? There are some good questions. So thank you very much for them. And if there's not, I think we might finish up there because we're at time. But I think just like to say a big thank you for everybody attending, or if you're watching back on YouTube, thank you very much. We're here should you have any questions throughout the 30 days, but even after 30 days, you can come back to us and we'll be very happy to help you. You're very welcome. Great. So with that, I will end the broadcast. Thank you very much. Goodbye.
See you now.